Proton therapy is like a sharp sword in our fight against cancer. It can treat the disease precisely while also protecting the patient's health. Proton therapy also requires a strong team to support it, with everyone doing their part and persevering over time.
A radiation oncologist is more like the captain of a ship. The direction the ship sails is determined by this doctor.
Physicists are the behind-the-scenes workers in proton therapy. They have two important roles. One is the designer of precise radiotherapy and the guardian of safety and quality.
Every precise irradiation in proton therapy relies on the therapist to carry it out.
Physicists are the safety guardians throughout the process and the warm-hearted service providers.
From admission to discharge, a case manager accompanies the patient throughout. Patients say, "We are the people they know best in the hospital."
Of course, whether the ship can reach its destination is not decided by the doctor alone. We also have our physicists, who are more like navigators, following the doctor's orders. They plot the course just like a navigator. And our therapists, they are more like a helmsman operating the machine to deliver precise treatment to the patient. We also have our nurses and case managers who, like sailors, ensure that our patients can smoothly complete their proton therapy through teamwork, providing patients with precise treatment.
Physicists are the behind-the-scenes workers in proton therapy. They have two important roles. One is the designer of precise radiotherapy and the guardian of safety and quality. Being the designer of precise radiotherapy means being responsible for designing every radiation therapy plan, performing dose calculation and optimization, to attack tumors to the greatest extent and protect normal organs. We are also the guardians of radiation therapy safety and quality, performing periodic checks on the radiation therapy machines to ensure they operate precisely.
The radiation therapy process is usually divided into 5 steps. Therapists are mainly responsible for the first and last steps, namely immobilization and treatment delivery. For immobilization, we customize a mold for the patient before radiotherapy so that the patient's position stays consistent in each subsequent treatment. Simulation and localization use imaging such as CT or MRI to scan and obtain internal body images. Therapists then mark the patient's body surface or the mold, ensuring that the body position can be precisely reproduced for each treatment. Treatment delivery is what we usually call going on the machine for treatment. Once the radiation therapy plan is designed and passes plan verification, the doctor will arrange patient positioning and treatment.
My daily work is full of small tasks, but also very fulfilling. Simply put, I need to keep an eye on 3 places: the radiation therapy ward, the radiation therapy clinic, and the Proton Center, and hold the line on 2 things: quality and safety. In every task, we focus on the patient's physical and mental state, from admission assessment to condition monitoring, specialized care, and so on.
As case managers, we essentially help patients get their treatment journey organized. Before they come to the hospital, they don't know the procedures. We list everything for them and answer their questions until we've actually paved the way for them. When they first arrive, I tell them in advance, "Call me when you get here." I take them step by step to see the doctor and then go for other tests. During treatment, I visit them every day, so they feel they're not fighting alone, but that someone is accompanying them. When they are discharged and go home, they are actually afraid of being ignored. Afterwards, there is always follow-up, doing follow-ups and reminding them to return for checkups.
Everything is done to a very high standard. From the moment a patient arrives, for instance, whether they are suitable for proton therapy, the department will organize a patient review, case discussion to decide. For some patients, we even invite surgery, radiology, and pathology teams to hold a multidisciplinary discussion. If they are suitable for proton therapy, then we move on to the proton treatment stage. Our technicians do very well in patient positioning and immobilization. When we make the plan, after it's done, the physicist completes it, and we then have an APR review, which is a discussion of the radiotherapy plan. Doctors, physicists, and technicians get together to discuss the plan and check if it meets our requirements and where improvements are needed. During treatment, the technicians, we don't just rely on the marker lines drawn on the body surface or the cross on the mask for positioning. We also perform a CBCT or KV imaging verification until the bony landmarks and tumor coverage are aligned before we start treatment. So in this situation, our setup error requirement for the head and neck is 3 millimeters. We often achieve only 1 or 2 millimeters. For the chest and abdomen, it must be within 5 millimeters. We often get only 2 to 3 millimeters. With this level of precision, we have comprehensive whole process management, achieving precise positioning, precise plan design, precise treatment delivery, what we call 3 precision therapy.
We have encountered many breast cancer patients who have had implants. In cases like this, we contact the manufacturer to obtain detailed information about the implant, including material and dimensions, and then contour it and replicate its actual properties to ensure accurate dose calculation and optimal treatment planning. For any patient who experiences changes during treatment, it can affect the beam, range, and dose distribution of the original Proton plan. So we always conduct a comprehensive assessment, and if the change has sufficient clinical impact, we will adjust and re-optimize the plan accordingly, which is adaptive planning, truly doing everything that should be done to ensure the plan is optimal.
We use quite a few sophisticated radiotherapy techniques such as gating, prone compression, and DIBH breath hold radiotherapy. During image verification, if we find the patient has bowel gas or increased stool, we will help the patient release gas on site in the treatment room or have the patient get down to have a bowel movement. It doesn't sound like a highly difficult procedure, but it is very time-consuming. To deliver precise treatment, we believe that spending this time on the patient is very worthwhile. We are willing to put in this slow, painstaking effort for our patients as long as it benefits them.
For proton therapy patients, especially children as well as elderly patients and other groups, we have developed personalized care plans. An elderly inpatient on our ward with a relatively complex condition and limited mobility, coupled with long-term treatment, remained in low spirits. Besides providing our professional nursing care, we focused more on companionship and psychological support, and gradually the patient became willing to communicate. The family said to us, deeply moved, staying in your department, we feel especially at ease and truly reassured.
No matter your identity, status, nationality, or age, in the face of illness, everyone is the same, and they too have a most vulnerable side. We are the ones standing by their side. Case managers should make others see us as the most reliable friends and the most familiar people in the hospital, so that patients can receive treatment with peace of mind and recover with confidence. That is the purpose of our Proton Guardian team.
Looking for trusted information about cancer treatment? Follow us to learn more about proton therapy, advanced cancer care, and treatment options.